I'm Dr. Lora Shahine. I'm a double board certified OB-GYN and reproductive endocrinologist practicing at Pacific Northwest Fertility in Seattle. So infertility has a lot of different definitions, but I usually use the one from the World Health Organization, stating that infertility is a disease in which someone's inability to get pregnant or carry a pregnancy to term after trying for about a year. And it can impact as many as 1 in 6 people worldwide. There's different types of infertility. In general, primary infertility is never being pregnant before and suffering with the inability to get pregnant. And secondary infertility is you've gotten pregnant before, had a live birth before, but you're struggling to add to your family. Some people will divide infertility into female factors and male factor infertility. I think that's important because there's a lot of misconceptions and societal assumptions that anything to do with having a baby or having a family is the woman's fault. And up to 50% of the time, there can be a contribution of male factor infertility. But in general, that infertility is just really wanting to have a baby and struggling to get to your goal. Age and fertility is everywhere. You've heard about your biological clock ticking. You hear that if you have a pregnancy after the age of 35, it's labeled a geriatric pregnancy. Listen, people are often waiting to start or add to their family later, and age is a big part of fertility, but there are people absolutely having babies without assistance into their 30s and 40s, but sometimes it's important to learn more and see if you might need a little help. The whole link between age and fertility is not just eggs, it's sperm too. It's just more dramatic with eggs. Sperm are made every single day, and there's lots that are made, and there's lots of options. But male factor fertility starts to be impacted by age later in your 40s and certainly by 50. For women, we are born with all the eggs we are ever going to have. And as we age, fewer and fewer of the eggs are able to do all of that genetic work that they need to ovulate, to fertilize with sperm, to turn into a healthy embryo that will turn into a healthy baby. And so it's not that with age, all of the eggs are bad. It's just that with fewer good eggs that can do all that genetic work, it can take longer to conceive, miscarriage rate increases, and fertility can just be more challenging as we age. Egg quality is a buzzword. It is certainly seen all over social media and people trying to help you with supplements and diets and detoxes to help your egg quality. It's not a really scientific term. I mean, to me, any egg that fertilizes with a sperm and turns into a beautiful embryo and turns into a baby is an excellent quality egg. But in general, I think people are trying to talk about ways to maybe improve your overall reproductive health in order to have your family on your terms when they're talking about egg quality. So when a patient asks me, do I have good quality eggs? I have to clarify something. An egg is a single cell that is sitting in these sacs of fluid called follicles within the ovaries. And unlike sperm that you can look at and analyze easily outside of the body with a collection and a microscope, eggs are sitting inside your body and they're ovulating. And even when we do IVF, let's say in vitro fertilization, where we extract eggs from the body and we're looking at them under the microscope, an egg is a single cell. It is just a big ball of water. And so just looking at it, you can't tell if it's good quality, but you can know if you do try to fertilize it and it turns into a beautiful embryo, and then you transfer that embryo later, then that was a great quality egg. And when people say, oh, these things affect your egg quality, like age, for example, what they're trying to say is that the longer the eggs are in our body, so the longer, the older we are, the older the eggs are, fewer and fewer of them are able to go through all of the genetic work that they need to in order to fertilize, turn into a healthy embryo, implant, and become a baby. So As we age, we know it takes longer to get pregnant. There's a higher chance of miscarriage. There's lower chances of success with fertility treatment. And a way to kind of put that all together is, oh, you have less egg, you have poor egg quality, and a part of that is age. And I think of egg quality as like, it's just, if it works, it works. And also when I'm talking to people about optimizing their reproductive health, they sometimes want to talk about egg quality or sperm quality. And I'm really just focusing on lifestyle factors, eliminating tobacco and smoking and vaping, eliminating heavy alcohol, thinking about nutrition, exercise, sleep, stress management. All these things are going to help egg quality, sperm quality, if you want to call it that. Lifestyle factors affecting your fertility are such a common question, because when you're trying to have a baby and it's not happening, you feel so out of control. You want to take back control of your fertility. So you're thinking about the things that you can do in your everyday life to have better quality eggs or better quality sperm, or just get pregnant faster. And you can't reverse age, which we talk a lot about impacting reproductive health, but maybe you could think about things that you're doing in your everyday life. So nutrition is important. Moving your body is important. Thinking about having a healthy weight, not underweight, and not too overweight. And listen, people can be fertile in all different sizes, but in general, thinking about a healthy weight that's right for your body. Sleep is essential. So focusing on sleep, that helps with our circadian rhythms. It helps with resetting our cortisol levels. It helps with all of hormonal function. Sleep is important. So nutrition, exercise, sleep, and stress management. You cannot eliminate stress. We all have stress, and just being infertile or not having a baby on your timeline is stressful in and of itself, but you can work really hard on tools that manage stress so that you can recover faster. Those are some of the really important things that I think about for lifestyle optimization. So stress management tools for fertility are really personal for each person. Some people really benefit from one-on-one therapy. Sometimes people don't have access to that, or they can't find a provider that really focuses on miscarriage or infertility. Sometimes insurance coverage is lacking, but one-on-one therapy can be amazing. There are also wonderful group therapy opportunities. Resolve.org is a national organization run by patients that runs online and in-person groups to sort of help. Fertility Out Loud is a wonderful website and resource for ways to kind of learn more about fertility, find support for fertility. Even in Seattle, there's wonderful classes that are like yoga for fertility that turns into kind of support networks. And then sometimes people just really need personal reflection time. Getting outdoors can help manage stress. Journaling, finding some of these apps, online, like Calm app, can really help you sort of reset, making sure that the whole fertility journey doesn't take over every aspect of life, still remembering to find joy, schedule those vacations. We always are sort of worried about, well, what if I'm early pregnant? What if I'm in treatment? Schedule the vacations, have something to look forward to. Maybe you just get traveler's insurance because maybe it's not the right time, but you can still do it in the future. When you're thinking about causes of infertility, in general, most of the time we'll talk about it sort of like a third of the time it's a female focused issue, a third of the time it's a male focused issue, and a third of the time it's a combination, and that often can include unexplained infertility. We think about anatomic issues, fibroids, especially if they're inside the uterine cavity, blocked fallopian tubes, if the egg and sperm can't find each other. We think about hormonal issues, thyroid issues, prolactin issues. Thinking about regular, predictable menstrual cycles can signal regular, predictable ovulation. But if someone's not having a regular cycle, and by that I just mean about once a month, not everybody has an exact 28-day menstrual cycle. And so for you, your norm might be every 26 to 27 days or every 30 to 32 days. Variation is normal. But if you're saying, I don't really know when I'm getting a period, I can't predict it or track it, that is a source of infertility because you might not be ovulating on a regular basis. And then male factor. So sometimes low sperm counts, low motility, low morphology, these can all impact the ability to conceive. We think about chronic medical conditions, sometimes diabetes in either partner. We did talk about some of the hormonal issues, hypothyroidism, prolactin issues. And then one of the most frustrating diagnoses is unexplained infertility. So you're having regular cycles, you do the testing, the anatomy is okay, the hormones are okay, the sperm count is okay, but yet it's been over a year, over 6 months, and you're still not getting pregnant. That is considered unexplained infertility. And it doesn't mean that there isn't an issue. It's just that with the testing that we have available to us today, we can't isolate an issue. So one of the lifestyle factors or things that people can look at in their everyday life are some of the products that they're using. We are learning a lot about endocrine disruptors and endocrine disrupting chemicals like in plastics, bisphenol or BPA, phthalates, parabens, a lot of these forever chemicals like PFAS that's in a lot of the, raincoats that are waterproof or a lot of the plastics in our kitchen. We are learning that we are actually absorbing a lot of these plastics and a lot of microplastics, and that they can impact egg health, sperm health, risk of miscarriage, fertility. And once you start to learn about this, it can be really overwhelming. And the evidence is there. So people that say like, oh, there's no evidence to prove it, that's not true. And I do think that a lot of products in isolation and the amount of things that we're exposed to are probably fine. But think about all of the things that we are exposed to every day. I mean, women put on average 10 products. If you think about mascara and the lotion, the laundry detergent that you're using is getting from the clothes into your body, dishwasher detergent, and so again, it can get really overwhelming, but I think if you make solid choices just kind of in your everyday life, you can dramatically decrease your exposure. And that's actually really exciting. And there are studies that show that if you make a couple of solid choices, you can check someone's levels of these environmental toxins, make some changes and check again, and the body does a great job of cleaning them out. You cannot eliminate exposure. It's literally everywhere, but you can make choices. And so some of those things, I really think about plastics in the kitchen. So, plastic food containers to store food or putting them in the microwave, like heat and plastic should not mix. So buy glass food containers to store leftovers. Heat up food in glass, not, in your microwave or on the stove, not in those plastic containers. Think about a glass or stainless steel water bottle. Think about your cookware. So Teflon and some of these non-stick pans are full of chemicals, especially the forever chemicals, and it's getting right into those eggs and foods. So I have, cast iron or carbon steel pots and pans that I've had for over 20 years. It takes a little bit more cleaning, but it's a forever pot and pan that is not giving you plastic chemicals. So I tell my patients, don't throw out all of your products. Like you think about your cosmetics or your lotions or your cleaning supplies at home. Just when you're running out of a product, check it out. Look it up online. Look at the ingredients. Look at some online resources like Environmental Working Group, and find a safer option if you want to. I have some products in my home that I'm just like, okay, listen, I've tried the safer options and there's just a couple of things that I got to keep around. So it's not all or nothing. It's just making safer choices as you go along. So So a lot of people ask like, hey, I did not know anything about environmental toxins or, you know, products when I was growing up. This is all new, or sorry, I'll start over. Shoot, I have that. I don't know why I just got a ding. I tried to turn everything off. One more second. I think we're good. Let me just close my calendar. Sorry about that. Okay. All right. A lot of, oh, I would love to wrap up by 9:15, 15 more minutes. Is that good? Okay, great, great. So a lot of my patients ask me about past things. I didn't know anything about toxins, in my 20s or 30s, or I had a lot of fun in college with a lot of different substances. Does that impact my fertility now? So, most important, you have to realize that the past is the past, and you can only control right now and what's moving forward. And honestly, people really do talk about sperm and eggs are on kind of a 3-month cycle from like an immature germ cell to ovulating if it's an egg, or coming out of the body if it's a sperm. And so you just can't worry about what you did before. I don't have any evidence, or I'm not aware of any research that says if you know, had a lot of substances and had a lot of fun in college, that it's going to impact your fertility later. But I can say that heavy regular alcohol use, heavy regular cannabis or marijuana use, things like that, tobacco, absolutely can impact fertility. So if you are imbibing and those things now, and you're really ready to start your family, maybe think about modifying and kind of talk to your doctor about what's right for you. So if you are planning to start trying, or you're trying now and you're curious about tips and sort of things to get started, I think number one is learning your body and learning your cycle. So if you are using some sort of birth control that is not allowing you to ovulate regularly, like the birth control pill, or maybe you have an IUD so you don't have periods anymore. If you're really ready to start trying, you want to learn about your body, learn about your cycles, then stop using that type of contraception. Maybe use an alternative, something like condoms, if you aren't ready to get pregnant, but learn about your body about 3 months before you're ready to start trying, or whatever is right for you. Because sometimes people stop hormonal contraception or IUDs or something like that, and they realize that they're not ovulating regularly, because the pill will sort of give you a bleed once a month. But that is just from the hormones that you're taking in the pill and the withdrawal of that. It's not your own body ovulating. So I think learning about your body, tracking, learning about ovulation is really important. There's signs of ovulation, changes in cervical mucus, little twinges kind of in the middle of the cycle. And it can be really, really helpful. You can use an app or just a paper calendar. Sometimes people are kind of nervous about all the information that apps are gathering. Just kind of follow your own cycle, learn your body. And if you are not ovulating regularly, don't stop, don't pass go. Like, go straight to the doctor and figure out, is this PCOS? Is it a thyroid issue? Like, figure out why you're not ovulating regularly. I have had patients who were not having periods, obviously not ovulating, and waited a whole year to see me. And so that is a year lost. So that's a really important tip. Tip number two is just a realistic understanding of how likely it is that you're going to get pregnant. We're taught in health class that it's so easy to get pregnant that, it just happens right away. And we are able to control our fertility with great birth control. But when you're trying to conceive, there's so many factors that it can take a little while. So it is pretty common. About 50% of people will get pregnant within the first 3 cycles if they are ovulating and they have pretty regular timed trying. About 80% of people will conceive within that first year. The textbooks say if you're having regular cycles and able to try, and you're less than 35 years old, you should try for a year, because so many people will conceive within that year. And that if you're 35 or older, if you've been trying for 6 months, you should really get testing and evaluation sooner, just because of the impact of age. I personally don't think people have to wait. I think if they're curious, I think it is empowering. And if you had to choose one test, a semen analysis, right? Like it's so easy to do, I think. It's the least expensive test, and it is really powerful information because up to 50% of the time there's a sperm factors as contributing to fertility. So learn your body, know your cycle, see a provider sooner rather than later, kind of on your timeline, just to make sure everything's okay. Seeing a doctor does not mean that you have to do fertility treatment. You are just learning and kind of getting a checkup and maybe even getting some coaching on timing and how long you should try before maybe you do some fertility treatments. And then think about your lifestyle optimization, some habits to stop like tobacco and vaping, and some habits to start like good sleep, stress management, thinking about your diet and exercise routine.